Assalamu alaikum. Now I would like to discuss about T-cell disorder. Starts with this DiGeorge syndrome. That there is thymic aplasia. In DiGeorge syndrome, there is 22q11 microdeletion. There is 22q11 microdeletion, and in for remembering the features of DiGeorge syndrome, you have to remember a mnemonic called catch 22. In catch 22, first is cardiac defect, that is chronotruncal abnormalities. First of all, there is cardiac defects, then abnormal faces, there is thymic aplasia, and this is the x-ray of thymic aplasia, and this is the baby with abnormal faces. And there is cleft palate, and there is hypocalcemia. Hypocalcemia leads to tetany. Hypocalcemia leads to tetany. Can you tell me what are the two signs we actually examine while there we suspect that this is hypocalcemia? The signs are Trousseau and Vostok sign. Okay. In thymic aplasia, there is decreased T cell, there is decreased calcium, and there is decreased parathyroid. And chest X-ray show absent thymic shadow. Can you tell me the other two causes of absent thymic shadow? One is Bruton's gamma globulinemia, and another one is SCID. This is the boy Noah, age 2 years old boy, suffering from this rare disease called interleukin 12 receptor deficiency. In interleukin 12 receptor deficiency, there is disseminated mycobacterial, and fungal infection. Look, the boy is suffering from Mycobacterium avium intercellular complex. It may present after BCG vaccination. If somebody has interleukin 12 receptor deficiency, and as a rule we actually give a baby the BCG vaccine, after giving this BCG vaccine, this baby might affect this baby get affected in the mycobacterial and fungal infection, and that time you have to suspect that this baby has interleukin 12 receptor deficiency. And in here there is interferon gamma is deficient. Interferon gamma is deficient. In here there is decreased T helper 1 response, and decreased interferon gamma. And from macrophage there is interleukin 12, then interleukin 12 will stimulate interleukin 12-1, which will stimulate interferon gamma. And in here there is decreased interferon gamma and decreased T helper 1 response. Third disease is Job syndrome or hyper IgE syndrome. In this Job syndrome and hyper IgE syndrome, there is the mnemonic is abscess. The mnemonic is ABCDEF abscess. The abscess is cold staphylococcal non-inflamed abscess. Before this is the This is this boy is probably 10 or 12 years old, but he has already retained the baby teeth. The retained baby teeth is second feature, and the third one is coarse faces. Look at the face. The face is coarse, and dermatological problem. There is derma problem. Dermatological problem, as the name suggests, there is increased IgE, hyper IgE, and F for fracture. Fracture in after minor trauma. After minor trauma, there is fracture, and in Job syndrome, there is deficiency of T helper 17 cells due to STAT3 mutation. So, neutrophil recruitment to the site of the infection is impaired. That's why there is decreased neutrophil, and that's why there is increased eosinophil and increased IgE. In hyper IgE syndrome, the name suggests that there is increased IgE, and the increased IgE indicates increased eosinophilia, and there is impairment of neutrophil to go to the site of infection. And that is all about Job syndrome. Now, last picture, this boy has some skin infection and some mucosal infection. This is chronic mucocutaneous candidiasis. In chronic mucocutaneous candidiasis, there may be non-invasive candida albicans infection of the skin and a mucous membrane. In here, there is T cell dysfunction, and we have already discussed that if somebody has T cell dysfunction or T cell deficiency, that guy has the propensity of developing viral or fungal infection. Okay, and these causes impairment of cell-mediated immunity against candida, and it is classic form caused by defect in AIRE. In here, there is absent in vitro T cell proliferation in response to candida antigen, and absent candida reaction to candida antigen. And that is all about this T cell disorder. This is a series of lecture while you will get phagocyte dysfunction, B cell disorder, T cell disorder, and B and T cell disorder. If you go through these 4 video lecture, inshallah, it would be very helpful for you to understand the immunodeficient disease. And all the thing I have taken from the first aid, and it's a great book.